Hello, everyone. I'm Atala. It is a pleasure to share my point of view on the subject. The survival time of restorations is shortened in patients with dry mouth. But first, have you ever wondered if dry mouth can influence the duration of dental restorations in our mouths? It is a curious question, isn't it? Given this, the answer is yes. But let's see. We must know perfectly well that the term dry mouth entails certain aspects. Dry mouth include xerostomia, characterized by a sensation of dry mouth, and hyposalivation, given by the decrease in salivary flow in the mouth due to a pathological issue, diagnosed in those patients who meet the criterion of 0.1 milliliters per minute of unstimulated saliva, which is not only uncomfortable, but also dangerous, as there is a greater probability of developing cavities and the life of dental restorations is shortened. According to data from the article, this condition occurs in 22% of adults. Now, what are the causes of dry mouth? This health problem can be caused by Sjogren's syndrome, radiotherapy, medications, sedatives, and others. But we must take into the account that there are susceptibility factors, such as being over 50 years old and being female. On the other hand, before we get into the study, let's see what aspects can affect the survival of dental restorations in all patients. Some modifying factors are type of tooth and location, restoration material used, size of the restoration, age and sex of the patient, oral hygiene, and of course, the protocol carried out. Once this is known, we can analyze the following study. A retrospective data collection study was carried out in Finland to determine the size of the effect of dry mouth on the survival of restorations and also on teeth. The study population consisted of 71 patients with dry mouth and 142 control patients, of which 3,208 restorations were analyzed using Kaplan-Meier survival curves and multivariate Cox regression analysis. As a result, it was found that the hazard ratio of restorations in patients with dry mouth was 2.08 compared to control patients. Among the most important specific points, it was noted that fixed restorations provided by crowns lasted longer than composites of any size, both in patients with dry mouth and in control patients. Furthermore, it was determined that the survival of restorations in patients with Sjogren's syndrome or radiotherapy-induced hyposalivation was lower compared to patients with hyposalivation or xerostomia of unspecific etiology, perhaps due to the quality of saliva or some symptoms related to the condition that interfere with good oral hygiene. Thus, teeth with crowns lasted longer than those with direct restorations, such as composites. And in terms of the lifespan of the teeth as such, patients with dry mouth had a risk ratio of 1.0 92 for dental extractions compared to control patients. Extractions in patients with dry mouth were twice as frequent as in control patients. With this data, and from a genomic and proteomic perspective, we can arrive at the hypothesis that suggests that dry mouth can occur due to abnormal activity of the cells of the immune system, generating an autoimmune disease such as Sjogren's syndrome, due to genetic variations or cellular variations that regulate an activity such as the inflammatory response, due to alterations in salivary cells, or due to alterations in protein profiles that induce the development of some disease, or that modify the composition of saliva. Thus, this condition affects the conditions of the mouth and thus the life of the restorations placed. Finally, we can conclude that in patients with dry mouth, there is a change in the duration of restorations in the mouth, since the life of this is noticeably reduced in some cases. For example, in those made directly, such as composites. However, crowns have a relatively acceptable lifespan. However, knowing this data is important so that during our clinical practice, we are aware of the prognosis that we will give to a patient with dry mouth regarding the restorations to be performed. Thanks for your attention.